At our BHC, we really focus on providing individualized and holistic care. If a patient's admitted to our facility or one of our programs and is struggling with both substance use and mental illness, then we have the team really structured to meet those individualized needs.
So the addictions programs that we have here are for adults, treat adolescents with addiction on an outpatient side. So we have 2 programs, generally lasting a few weeks at a time, where people go through groups. They can also see a medication provider as well, because of course with addiction sometimes there are other mental health issues that go along with it, and sometimes those things need to be treated as well. But those programs are for people who are addicted to any substance. So it can be alcohol, it can be marijuana, it can be cocaine. And if they come here, we can kind of screen everybody or screen that person to see if going straight to that addiction program is the right thing for them, or if we need to admit them to the inpatient unit first to detox and then transfer them to that program. It can be really hard on loved ones. I mean, to see their child, whether it's a teenager or the person is an adult, going through addiction and watching them literally go from sometimes a functioning person down to the point where they can't function is really trying for people. We have caregivers who want their child, or like I said, whether it's an adolescent or an adult, to go to an addictions program, and they don't want to. And they want this person to get better so that they don't end up passing away on the street or passing away from an overdose, an accidental overdose. They want the person to get better, but also the adolescent or the person who's experiencing it has got to want to get better. And if they don't want to, you can't make anybody do those things.
My past relationships with my parents, with my ex-husband, with my siblings, I think that it helps me to be more empathetic with my patients, kind of get a better understanding of how their addiction has affected others, and kind of give them some insight on what it could look like if it progresses, how it's maybe affected their loved ones in a way that they don't understand or just haven't recognized yet. So I think that the individual therapy portion, they're able to confront a lot of internal issues that maybe they're not as open to sharing within a group therapy. And then we have our peer recovery specialist who kind of takes that role as, I've been there, you know, I can help you see how to change or what I did. And then you have the therapists who are there to educate you on everything and tell you, you know, how this affects your brain, how this affects different organs, you know, the cycle of addiction, the relapse prevention models. We have other therapists who come in who do our recreational therapist. She helps teaches you mechanisms to do when you're alone and you're bored to help prevent that relapse from occurring. We have our pharmacists come in and teach you why medication management is so important. So I almost kind of teach patients how to live successfully a daily routine without using drugs and alcohol. Ways to cope with external and internal stressors, things to do to keep them busy, to take their mind off of intrusive thoughts, educating them on the impacts of their addiction, whether it be alcohol or illicit substances, the different diseases and conflicts medically that it could lead to, like cirrhosis, wet brain, neuropathy, any kind of physical or emotional, you know, damage that drugs and alcohol do cause, because we know that once you're dependent on an illicit substance or alcohol, everything kind of shifts in the brain, and that's when your mental health starts to deteriorate.
So I like to say that I'm an emotional support human. I support people who are coming from active addiction into recovery. I told somebody the other day he had all these problems. He had court, he had another court, he had a probation officer, he has a parole officer, he has another ticket, he has his parents, he's all these problems. And I said, how do you eat an elephant? And he said, I don't know. And I said, one bite at a time. So we're just gonna take one problem at a time and solve, you know, talk to the probation officer, find you a recovery home to go to. So he's gonna go from bed to bed, and what that means here is from a bed in our hospital to a 30-day program. We want you to get better. Everything we do and say here, we want you to succeed. We care for you like we care for our own family. You can do this, that anybody can do this. If I can do this, anybody can do this. Because my family told me I was hopeless. I was hopeless.